Okay. Perfect. Walk in. I'm gonna provide some privacy, do some hand hygiene. Hi, can you tell me your name and date of birth?
Kara Berger, 5105.
Okay, my name's Elizabeth. I'm your student nurse today. I'm just gonna be doing a full head to toe assessment. It should take about 20-25 minutes if that's okay with you. Okay, perfect. I'm gonna go ahead and get started. The facial features are symmetrical. The external nose is midline with no deformities, lesions, or inflammations. And now I'm gonna go ahead and palpate the maxillary and frontal sinuses. So let me know if you have any tenderness. Okay, was that tenderness?
Nope.
Patient denies tenderness in the maxillary and frontal sinuses. And now I'm gonna go ahead and palpate down your external nose. If you have any tenderness, please let me know. Is that tender?
Nope.
Okay, and if you could go ahead and occlude an air and breathe in. Another one, breathe in. Okay, the patient denied tenderness in the external nose and the nares are patent. And now I'm gonna make sure I did everything. Okay, now I'm gonna go ahead and look at the lips. The lips are pink and appropriate for ethnicity and race. There is no lesions, inflammations, deformities, or crackings, and they appear moist. And now I'm gonna go ahead and peek inside of the mouth. So if you could say okay. The pharynx is pink with no exudate or edema. The tonsils are pink in grade 1, and the uvula rises with phonation. And the tonsils are also pink. Don't know if I said that. And then I'm gonna go ahead and look in again. So if you go and stick the tongue to the roof of your mouth and to the side. Okay, perfect. The tongue, roof of the mouth, floor of the mouth, and mucosa are pink with no inflammation, no growths, no deformities or lesions. And the tongue is even, symmetrical, and midline. Okay. So now I'm gonna go ahead and look at the teeth. So if you say cheese, okay. The teeth are white, evenly spaced, free of dental caries. Evenly spaced, white. And the gums adhere to the teeth with no discoloration or bleeding. And now I'm gonna go ahead and move on to the eyes and ears. So first I'm going to start by stating, in practice I tested my patient's distant visual acuity using the Snellen chart, and the patient was, do you wear any lenses? Okay, no lenses or glasses, and the patient was 20/20 in the left eye, 20/20 in the right eye, and 20/20 in both eyes, and I tested cranial nerve 2. In practice, I also tested my patient's near visual acuity using the Rosenbaum chart, and they were able to read newsprint 14 inches from their face. They were 20/20 in the left eye, 20/20 in the right eye, and 20/20 in both eyes, and I tested cranial nerve 2. I'm gonna go ahead and have you look at my pen light, and if you could just follow the pen light and not with your eyes, not your head. Okay, the patient was able to follow the 6 cardinal fields of gaze with no nystagmus present, indicating that the extraocular muscles were intact. I tested cranial nerves 3, 4, and 6. And now I'm gonna go ahead and do Perla. So the pupils are round, they're equal in size. They are about 4 millimeters in diameter. And now I'm gonna go ahead and shine the light on both of your eyes twice. Okay, do this one again, I'm gonna do this one again. Pupils are reactive to light, and if you could just look at my pen light for me, and look at the wall behind me, back at the pen light. Okay, pupils are able to accommodate, and I tested cranial nerve 3. And now I'm gonna go ahead and inspect the eyes. So you go ahead and pull it out for me. Okay, and you go ahead and release. The conjunctiva is clear and pink in the lower lids. The irises are brown. The sclera is white. The cornea is clear, bright, and smooth. The upper and lower lids are intact with no edema or exudate. The eyebrows are symmetrical and evenly distributed. The eyelashes are evenly distributed and slightly curved outwards. And now I'm gonna go ahead and palpate. I usually would put on gloves, but I do not have any gloves. So I'm gonna go ahead and palpate. If you have any tenderness, please let me know. Okay. And then I'm gonna do upper and lower lids and eyebrows. Is that tender at all?
Nope.
Okay, the bony orbit, eyebrows, and eyelids, upper and lower, were non-tender, and the lateral apparatus was non-tender with no drainage present. And I'm gonna make sure I did everything with the eyes before I move on. Okay, I'm gonna go ahead and move on to the ears. And I'm gonna go ahead and look at the ears here. The ears are symmetrical and the top of the ears are even with the eyes. They are pink and appropriate for ethnicity and race. There's no lesions or deformities present. There are 2 piercings in each ear. And now I'm gonna go ahead and take a peek in the ear canal. Okay. Okay, both ear canals are clear. Now I'm gonna test your auditory function, so if you could just raise a hand on which side you hear my hands. Okay, patient's hearing is intact with cranial nerve 8 tested. So I did nose, mouth, throat, eyes and ears, and now I'm gonna move on to the skin. So I'll be looking at both upper and lower extremities during this. The skin is pink and appropriate for ethnicity and race. It appears clean, dry, and intact. And I'm gonna go ahead and assess for temperature, texture, and turgor. So first with temperature. Now for texture. Okay, the skin is warm, firm, and smooth. And I'm gonna do turgor. Okay, turgor is less than 2 seconds. And now I'm going to go ahead and describe a lesion. So I'll do this one right here. The lesion is symmetrical with an even border. It is brown in color and evenly distributed throughout. I don't have a ruler, but it appears to be about 2 millimeters in size. And have you noticed a change in this at all? Okay. There is no evolution and no elevation or exudate. And now I'm gonna go ahead and do the nails. So the nails are pink. They are slightly round, they're smooth, and yeah, and now I'm gonna do cap refill on the fingers. Cap refill is less than 2 seconds, and now I'm gonna look at the toes. I'm gonna lift up your feet so you can see here. The toes are painted white, but they are smooth and they're slightly curved and rounded. Let's see here, what else did I have to do there? Okay, and now I'm gonna do cap refill on the toes. Cap refill returns within 2 seconds. And now I'm gonna go ahead and assess the hair. Make sure I did everything with skin first. I don't know if I did turgor, so I'm just gonna do it again. Turgor is less than 2 seconds. Okay, now I'm gonna go ahead and assess the hair here. Okay, the hair is wavy, it is brown, it is pretty thick, and it is evenly distributed. And now I'm checking for parasites at the nape of the neck, behind the ears. There are no parasites present behind the ears or at the nape of the neck. And now I'm going to assess the neck. Neck is symmetrical with no lesions or no masses or scars. Okay, now I'm going to move on to, I just did skin. I'm going to move on to cardiovascular now. So first I'm going to start by inspecting the carotid arteries. Carotid arteries are symmetrical with no bulging or jugular vein distension present. And I will be listening for, at the carotid arteries for a bruit present with my diaphragm using light pressure. There was no bruit heard upon auscultation. And now I'm going to go ahead and palpate the carotid arteries. Okay, carotid arteries are +2 and smooth and regular bilaterally. And now I'm going to go ahead and palpate the precordium. Let me know if you have any tenderness. Is that tender? Okay. There were no masses, nodules, tenderness, or pulsations felt upon palpation. Now I'm going to go ahead and assess. I'm going to listen for the heart sounds. Okay. Yeah, I think I'm good. First, I'm going to start with the aortic on the right sternal border, second intercostal space. And next is the pulmonic on the second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. tricuspid, which is the fourth intercostal space, left sternal border. And now I'm gonna go on the mitral, which is on the fifth intercostal space, left midclavicular line. Okay, now I'm gonna listen to all 5 again with light pressure this time. Aortic, pulmonic, herbs, tricuspid, and mitral. Okay, heart rate was regular, and heart rate and rhythm was regular and even. S1 was louder than S2 at the apex. S2 is louder than S1 at the base. There were no extra heart sounds or murmurs heard. And if I would assess the apical pulse, I would listen in this area down here for a full minute. And okay, let me make sure I got everything on that. So I did all that. I listened, palpated. Apical pulse. I feel like I'm forgetting something. What am I forgetting? Am I forgetting anything? I think I'm good. I think I'm good. Okay, now I'm gonna move on to lung sounds. And I seriously feel like I'm forgetting something, but I'm gonna move on. I'll move on to lung sounds. Okay, so first I'm gonna start by inspecting the breathing rate, rhythm, and depth, I think. Okay, breathing is even and unlabored, and to count the respiration rate, I would make sure to count respirations for 30 minutes and multiply by 2. And now I'm going to go ahead and, okay, now I'm gonna go ahead and do this part. The facial expression is relaxed. Can you tell me your name and date of birth?
Careberger.
Okay, and your date of birth?
5/10/05. Sorry.
I was like, wait a minute. And then, can you tell me where you are right now?
The apartment.
And do you know why you're here?
I live here.
And do you know what year it is?
2025.
Okay, the patient is alert and oriented ×4. The patient is in a relaxed, pleasant condition. There is no cyanosis around the tip of the nose or the lips. And now I'm gonna go ahead and inspect the thorax. The thorax is elliptical and symmetrical. Transverse to AP diameter is 1 to 2. The patient is sitting upright with no tripoding present. And now I'm gonna go ahead and do the coastal angle. Okay, coastal angle appears to be less than 90 degrees. And now I'm going to go ahead and assess for tenderness, masses and nodules, and chest stability. So let me know if you have any pain. Same thing on the back. Thank you. Any pain?
Nope.
Okay. No masses, nodules, or tenderness. And now I'm going to assess chest stability. I'm going to do this. You go ahead and breathe in for me. Okay, perfect. The chest wall is stable. Now I'm going to go ahead and auscultate the lung sounds. Every time this touches, if you'll just take a deep breath for me. Go down here. And drop the pen light, other side. Okay, and now if you turn around for me. Okay. The anterior and posterior lung sounds are clear to auscultation in all lobes bilaterally. I did not hear any adventitious breath sounds. If I did, it could be crackles or wheezes. There could be coarse or fine crackles, and the fine crackles would sound like high-pitched popping noises, while the wheezes would sound like high-pitched musical squeaky noises. And now I'm going to move on to the peripheral vascular section. So I'm going to start by inspecting the upper extremities. The arms are pink with appropriate for ethnicity and race. There's no increased temperature. There's no edema present, and if you could do this for me. Okay, and there is no clubbing present. And now I'm going to go ahead and do the radial pulses. Okay, the radial pulses are +2 even and regular bilaterally. I'm gonna do brachial pulses. Brachial, doing brachial now. Brachial pulses are +2 and even bilaterally. And I'm gonna think for a second because I just want to double check that I got everything. I like felt all that, did this, did upper. Okay. Yeah, I think I'm good. I'm gonna go ahead and move on to the lower extremities. The legs are symmetrical. Do you shave?
Yes.
Okay, there is no hair present. No discolorations, ulcers, or varicosities. And now I'm going to go ahead and palpate. Okay, oh, this pen light just
There we
needs
go.
to- Okay, there is no increased temperature, and I'm gonna check edema here. And there is no edema in the posterior tibial or malleolar areas. And now I go ahead and I would assess the femoral pulses. Wait, yeah, okay, yeah, I'm good. I had to think for a second. I'd assess the femoral pulses up here, and the normal finding would be +2 smooth bilaterally. Now I'm gonna find the popliteal pulses back here behind the knees. Okay, I found them, and they are +2 smooth bilaterally. And I'm gonna go ahead and lift up your feet here so they can see me. I'm assessing the posterior tibial pulses on the insides here. And they are +2 smooth bilaterally. I'm just gonna lift this up so they can see where I'm finding this. Okay, and then I would do the dorsalis pedis pulses right here. And they are +2 and smooth bilaterally. And now we're gonna go ahead and move over to the couch so I can do the other part. Just gonna move this here. Perfect. Maybe I should do it over here. Oh shoot, so they can see what I'm doing. There we go. Okay. First I'm gonna start by inspecting the abdomen. So the abdomen is symmetrical, flat, and even in color. And now I'm gonna ask you to bear down for me. Okay, there are no hernias present. There are no aortic pulsations present, and the umbilicus is inverted. Now I'm gonna go ahead and listen, starting in the right lower quadrant. The bowel sounds are normal, active in all 4 quadrants. And now I'm gonna go ahead and have you bend your knees, and I'm gonna go ahead and palpate. Actually, I'm gonna listen for an aortic bruit first, using light pressure with my diaphragm. Okay, there is no aortic bruit present. And now I'm going to go ahead and palpate. Let me know if you have any tenderness. Is that tender? Nope. Okay, the patient denies tenderness. There were no masses or nodules felt during palpation and no guarding felt. And now I'm going to go ahead and do CVA tenderness. So if you'll go ahead and sit up and turn around for me. I am going to the patient's last rib and taking the ulnar aspect of my hand. And the ulnar aspect of my hand. Okay, was that tender? Nope. Patient denies CVA tenderness. I'm gonna back this up and we're going to do musculoskeletal. Okay, so if you just wanna, yeah, you can stay like that for me. If you can go ahead and flex, thank you. If you can go ahead and flex your arms up. Oh, no, okay. Do you have any surgical history that I should be aware of?
No.
Okay, first I'm gonna start by inspecting the shoulders. The shoulders are symmetrical with no swelling or deformities shown. And now I'm going to go ahead and feel the shoulders here. Is this tender at all?
Mm-mm.
Okay, there are no masses, nodules, or tenderness felt. And I'm gonna feel for increased temperature. There's no increased temperature. And now if you just move around your shoulders a little bit. Okay, there is crepitus present within the shoulders. And now I'm going to ask you to Put your hands up like this for me. Flexion, and now extension, and now hyperextension, and now, okay, if you could circumduct for me, and now if you could abduct, you could adduct. Okay, patient shows active range of motion in the shoulders, and now I'm going to ask you to shrug your shoulders. If you could abduct against my hands, and now abduct. Now if you could flex up and flex down. Okay, patient shows +5 muscle strength, and I'm going to ask you to lay down, and I'm going to go ahead and assess the hips. So the hips are symmetrical, no swelling or deformities present, and I'm going to go ahead and feel the hips real quick. Okay, was that tender? There are no masses or nodules or tenderness felt, and I'm going to feel for increased temp. No increased temperature, and if you could just move around your hips a little bit. Okay, there is no crepitus present, and now I'm going to ask you to get the frame. Okay, I'm going to ask you to abduct out for me, and if you could abduct out with the other leg. Okay, and now if you could flex up and down. Okay. And now if you could internally rotate your knee, I'm going to ask you to bring it up and internally rotate it. Okay, and then same thing with the other knee. Okay, and now if you could externally rotate it and externally rotate it. And now I'm going to ask you to abduct out for me and abduct out for me. Okay, and now if you could flex up, and now if you could circle them. Okay, the patient shows active range of motion with +5 muscle strength, and now I'm going to provide privacy. I'd exit the room. I'd give you your call light, make sure you're in a safe, comfortable position, provide privacy, do some hand hygiene, and document. Yay! Hand hygiene, patient privacy. Hi, my name is Molly. I'm going to be your student nurse today. Could you tell me your name, date of birth, and any allergies?
Grace 4, 10/11/2004, no allergies.
Perfect. So today we're just going to be doing a quick head-to-toe assessment. It should only take about 10 to 15 minutes. It's just something we do before the provider sees you, just to go over your body systems. Is this okay with you?
Yeah.
All right, thank you for your time. Patient appears to be in good spirits. She's smiling. Are you having any concerns with your mood?
No.
Okay, posture appears to be good. She's sitting up straight, no slouching noticed. Hygiene appears to be good. Patient appears clean, no malodorous smells. Do you have any lines, tubes, or drains?
No.
Okay, and are you in any pain today?
I'm not.
Okay, could you rate your pain on a scale of 0 to 10?
0.
0? Okay, perfect. So now I'm going to be doing a quick neurological assessment, just 3 simple questions and then some other things. So do you know where you're at right now?
The study room.
Okay, do you know who's president?
Donald Trump.
And do you know the date today?
It is April 23rd, 2025.
Okay, patient is alert and oriented ×4. Speech appears to be good. There's no slurring of words. Okay, so now I'm just going to be checking for your facial symmetry. Could you smile for me? Okay, and could you puff out your cheeks? Okay, and now I'm going to have you pull my hands towards you. Okay, and then push them away. Same with the feet. Push like a gas pedal. Okay, pull up. Okay, strength is intact in all 4 quadrants. And now I'm going to be checking your sensory. So if you could close your eyes for me and tell me where I'm touching you.
Left arm, left leg, right arm.
Okay, perfect. Sensory appears to be intact in all 4 quadrants as well. So now I'm going to be moving on to a head and neck assessment. So I'm just going to take a feel of your scalp and take a look. Scalp appears to be normal cephalic shape, no bugs or excessive dandruff noted, and no bumps or lumps on the scalp as well. So now I'm just going to be taking a look at your eyes. Okay, if you could follow this light for me without moving your head. Perfect, and focus on this light, and then focus on the wall behind me. Okay, pupils are equal, round, and reactive to light and accommodation. Eyebrows and eyelashes appear to be normal bilaterally. They're present. I'm going to take a look at your conjunctiva real quick. Conjunctiva is pink and moist. And then I'm going to take a look at your nose, mouth, and ears. So if you could look up for me. Okay, and then plug one nostril and breathe in. Okay, same with the other. Okay, nostrils appear to be patent, no occlusions or polyps noted, and no congestion. So if you could open your mouth for me. Okay, tongue appears to be midline, good oral hygiene. Oral mucosa is pink and moist. So now I'm going to be taking a look at your ears. Okay. Perfect. Ears are equal bilaterally, no redness or drainage. Do you wear any hearing aids?
No.
Okay, do you wear any contacts or glasses?
No.
Okay, so if you could, I'm gonna have you read my name tag.
Molly R., BSN student, School of Nursing.
Okay, patient's vision is good and intact, and so is her hearing. So now I'm gonna be moving on to my cardiovascular assessment. So now I'm gonna be taking a feel of your carotid arteries. Okay. Pulses are equal bilaterally, +2 non-bounding. And now I'm just going to be taking a listen of those to look for any bruit. Perfect. Okay, and I'm going to have you look this way. Okay, and look back towards me. No jugular vein distension noted, and there was no bruit present upon listening to the carotid arteries. So while I have my stethoscope out, I'm going to go ahead and listen to your heart sounds. Okay, if you could you lift your breast up for me? Okay, heart rate is between 60 and 100 beats per minute. S1 and S2 sounds are present, and there appear to be no murmurs. Do you have any concerns with your heart today?
No.
All right, perfect. So now I'm going to be feeling of your pulses on your arms. So if you could hold out your arms for me, checking brachial pulse first. Okay, pulses are equal bilaterally, +2 non-bounding. Same here. Let's see. Okay, radial pulses are equal, +2 non-bounding as well. And I'm going to check your cap refill on your fingers. Cap refill is less than 2 seconds. So now I would normally have her take her shoes off, but I'm not for this. I'm going to be checking pedal pulses. Pedal pulses are equal bilaterally, +2 non-bounding, and I'm going to be checking your cap refill. Cap refill is less than 2 seconds. Okay. And no concerns with your heart, correct? Okay, perfect. So now I'm going to be moving on to a respiratory assessment. As I was going through my assessment, I noticed that the patient had a symmetrical breathing pattern, no labored breathing, no retractions noticed, and patient's breath were between 12 and 20 breaths per minute. Any concerns with your respiratory system?
No.
Okay, so now I'm going to be taking a listen to those breath sounds. First, I'm going to be doing your anterior lung. And every time you feel the stethoscope, take a deep breath in. Okay, no adventitious breath sounds on the anterior lung. So now I'm going to be taking a listen to your middle lobe. So if you could, lift your right arm up for me. Okay, no adventitious breath sounds here, no stridor, wheezing, rails, or anything like that noted. So now I'm going to be listening to your posterior lung. So if you would, could you turn this way for me? Okay, no adventitious breath sounds noticed posterior as well, and there were no crackles, wheezing, stridor, anything like that noted, and no concerns for this, correct?
Mm-hmm.
Okay, perfect. So now I'm going to be moving on to my GI and GU assessment. When would you say your last bowel movement was?
Last night.
Last night, and how many times a day would you go?
Once.
Once, and this is normal for you?
It is.
Okay, and are they of normal color, consistency, odor?
They are.
Perfect. When was the last time you voided?
About an hour ago.
And how many times a day?
Probably about 6.
And this is also normal for you?
This is.
Okay, and was it normal color, consistency, and odor?
It was.
All right, sounds good. So now we're going to be doing an abdominal assessment. So if you could lay back for me, I'm going to be inspecting your abdomen, and then I'm going to be auscultating. Okay. Abdomen appears to be flat. There are no convex or concave areas, and abdomen is non-distended, and there is an aortic pulse present. So now I'm going to be auscultating, starting with the right lower quadrant. Okay, bowel sounds are normal, reactive in all 4 quadrants. Nothing noted that needs to be concerned about. So now I'm going to palpate all the quadrants and let me know if you feel any pain or tenderness at all, okay? Any pain with that?
Nope.
Okay, there appears to be no rigidity or pain in the abdomen, so you can go ahead and put your shirt down. Alrighty, now we're going to move on to a musculoskeletal assessment. So if you could, I'm going to have you lift your arms up and touch your toes. Full range of motion in the spine is noted, and if you could look up for me and look down and then side to side. Full range of motion in the neck, and then shrug your shoulders. Okay, there's range of motion in the shoulders as well. So now I'm going to have you rotate your arm and be checking for crepitus. No crepitus noted in the right arm, so now I'm going to have you lift up, out, and down. Full range of motion in the right arm. Same with the left. I'm going to have you rotate this. Okay, no crepitus noted in the left arm. Again, up, out, and down. Perfect. Now I'm going to be doing the same in the lower extremities. So we're going to rotate this leg. Perfect. Now rotate this leg. Good. Now lift up. Slight crepitus noted in the left knee. And no crepitus in the right. And there's full range of motion in all of the lower extremities as well. And now I'm going to have you walk to the door so I can assess your gait. Okay, gait appears to be steady, no dragging of the feet, no slouching. Is your balance okay?
Yep.
All right, perfect. So now I'm going to be moving on to the skin assessment. Just going to be checking for your temperature. Okay, skin is warm and appropriate to ethnicity. It is pink and pale. And then no moisture noted. So now I'm just going to be checking for your skin turgor. So I'm going to pinch right here. Okay, no tinting noted. Same thing on the hand. Also no tinting noted. Now I'm going to be checking for edema on your legs. Okay, and there appears to be no edema present. Any skin concerns?
No.
Okay, no wounds or rashes?
No.
All right, perfect. So I think that concludes our head to toe assessment. Thank you for your time today. Hand hygiene.